Good day, everyone. This chapter talks about the viral diseases in fish and penned shrimps. Viruses are ultramicroscopic organisms with size ranges from 10 to 300 nanomicrons. Because of their size, viruses are able to pass through filters of zero point 0.5 micron pore size. Viruses have cubical or polyhedral, helical or complex morphology or symmetry. These microbes are obligately parasitic, multiplying only in its live host. Aquatic viruses are transmitted from fish or shrimp to other fish or shrimp, from water to fish or shrimp, or from reservoir to fish or shrimp by horizontal transmission. Disease transmission can also result from brooder to eggs or fry via vertical transmission. Known reservoirs of viral pathogens are farmed fish or crustacean, imported fish or crustacean, wild fish or crustacean, other aquatic animals or plants, and survivors of viral epizootics. Diagnosis of viral infections can be made by a combination of various methods such as signs of disease, detection of inclusion or occlusion bodies, electron microscopy, or infection enhancement bioassay. Tissue culture techniques can also be used. However, no continuous cell line from shrimp has been established. Other techniques based on the principle of serology are also applied in the diagnosis of viral infections. The more commonly used tests include neutralization index determination, Western blot, enzyme-linked immunosorbent assay or ELISA, fluorescent antibody technique, and indirect fluorescent antibody technique. Molecular biology techniques such as polymerase chain reaction or PCR, reverse transcriptase polymerase chain reaction or RT-PCR, DNA probe have been developed and is currently widely applied for diagnosis of viral infection of shrimps. To establish the pathogenicity of a virus, provisions embodied in the reverse postulates are followed. First, the virus must be present in the host cells, blood or body fluids showing specific lesions at the time of the disease. Second, filtrates of infectious material, blood or tissue shown not to contain bacteria or other visible cultivable pathogens in inanimate media must produce the disease or specific antibody in appropriate animals. Third, similar filtrates of animals or plants must transmit the disease. It is only when these provisions are complied that a virus can be considered pathogenic to fish or shrimps.
Major viral infections in fish. First is the epizootic ulcerative syndrome or EUS. EUS is a complex disease attributed to a combination of rhabdovirus, the bacterium Aeromonas hydrophila, and the fungus Aphanomyces invadans. It affects species such as snakeheads, catfish, climbing perch, spiny eel, gourami, barbs, serpentfish, sand goby, and many more. EUS lesions are characterized by severe ulcerative dermal necrosis with extensive erosion or sloughing of the underlying musculature. The necrotic muscular tissue emits a foul odor. Fish manifest frank ulcers consisting of eroded dermal layer exposing the underlying musculature, which may be hemorrhagic. Fish with less severe lesions exhibit scale loss with erosion of the skin surface with or without hemorrhagic signs. The histopathological profile of the disease consists of chronic necrotic and mycotic granulomatous inflammatory response. EUS is transmitted by cohabitation with deceased fish or exposure to contaminated waters. The virus replicates at 15 to 25 degrees Celsius in 2 to 3 days to 107 median tissue culture infectious dose per ml in SHS cells and in SSN1 cells. To diagnose the viral infection, signs of disease and isolation or identification of the isolated virus, Aeromonas hydrophila or Aphanomyces species, histopathology, and electron microscopy. Next is grass carp hemorrhagic disease. This viral infection is caused by aquarivirus. It affects grass carp, black carp, top minnow gudgeon, silver carp, Chinese minnow, and rare minnow. Clinical signs include exophthalmia, hemorrhagic or pale gills, and hemorrhagic fin bases or gill covers. Internally, hemorrhages occur in the musculature, oral cavity, intestinal tract, liver, spleen, and kidneys. Naturally and experimentally infected fish manifest reduced erythrocytes. plasma protein, calcium, and urea nitrogen. Serum potassium is elevated. Signs of disease and mortality are observed within 1 to 2 weeks of exposure of fish and water at temperatures of 25 degrees Celsius or higher. Experimental vaccination induced 80% level of immunity by day 4 at temperatures above 20 degrees Celsius. For the diagnosis, the virus can be propagated in cell cultures of GCK84, GCG, and GCF yielding titers as high as 108 to 109 median tissue culture infectious dose per ml. In vitro replication is considered optimum between 28 and 30 degrees Celsius, inducing CPE in 3 to 4 days post-inoculation. Reverse transcription polymerase chain reaction, or RT-PCR, and electron microscopy are also used for detecting the virus. Next viral infection is the channel catfish virus disease, or CCVD. This viral infection is caused by herpes virus ictaluri. It mainly affects channel catfish. Acute infection of cultured channel catfish fry and fingerlings less than 10 centimeters long, juveniles and adults occur following waterborne exposure to CCV. Clinical signs are abdominal distension, exophthalmia, pale or hemorrhagic gills, petechial hemorrhage at the base of the fins, and throughout the skin. In 20 to 50% of the epizootics, affected fish swim in head-high or hanging position at the surface. Severe mortality of sometimes nearly 100% occur among young-of-the-year Ictalurus punctatus at water temperatures of 25 degrees Celsius or higher within 7 to 10 days. It causes moderate mortalities at 21 to 24 degrees Celsius and almost no mortalities below 18 degrees Celsius. Secondary invasion of external lesions of Flavobacterium columnares, Aeromonas hydrophila, or aquatic phycomycetes may develop. CCD develops into hemorrhagic viremia after initially replicating in the kidney and then in the spleen. Thereafter, the virus is transported to the intestine, liver, heart, and brain. Necrosis of the renal hematopoietic tissue and tubules, edema, necrosis, and congestion of the liver, intestinal edema, congestion, and hemorrhage in the spleen are characteristic histopathological findings. Skeletal muscle hemorrhage among experimentally infected fish has been observed. The portal of entry for CCV from water is through the gills and the gut. The virus can be isolated from the kidney of fish with active infections during an epizootic using CCO or BB cells, which develop CPE 24 to 48 hours post-exposure. The virus is readily transmitted from fish to fish during an epizootic. For the diagnosis, electron microscopy, serum neutralization test, indirect fluorescent antibody technique, nested polymerase chain reaction or PCR, and by a channel catfish virus probe are used. Next is the viral nervous necrosis or the VNN. This viral infection is caused by nodavirus. It is also known as paralytic syndrome, viral encephalopathy, and retinopathy, spinning grouper disease, piscineuropathy, or fish encephalitis. The affected species are grouper, sea bass, barfin flounder, European bass, parrotfish, striped jack, turbot, Japanese flounder, and many more. Affected larvae and juveniles show lethargy, pale color, lost appetite, thinness, loss of equilibrium, and corkscrew swimming. Some fish sink in the bottom, then float to the surface again. This disease is more severe in less than 20 days old larvae. Deceased fish had pale livers, empty digestive tracts, the intestine is filled with greenish to brownish fluid, and the spleens are red spotted. The virus replicates in the eye, the brain, and the distal spinal cord of affected fish, causing vacuolating encephalopathy and retinopathy. It also multiplies in the gonad, liver, kidney, stomach, and intestine. The virus is more virulent at 28 degrees Celsius than at 16 degrees Celsius. Fish broodstocks can be virus reservoirs. Histopathology showing vacuolations in the nerve cells of the eye retina and the brain of affected fish is diagnostic for the disease. The virus can be isolated in SSN1 and Barramundi cell lines on which it induces CPE. The virus can be identified by electron microscopy, PCR, RT-PCR, ELISA, fluorescent antibody test, and by in situ hybridization assay. Another viral infection is the spinning tilapia syndrome or ST syndrome. Iridovirus is the causative agent of spinning tilapia syndrome. It affects species of Orychromis mozambicus, Euchromis aureus, Euchromis niloticus, and Sarotherodon gallerius. Affected tilapia fry and fingerlings swim in spiral pattern, sink to the bottom, then rise and hang at 45 degrees angle just under the water surface, gasping for air. They do not feed and are darker in color. Tilapia manifesting the spinning syndrome die within 24 hours of onset. Histopathologically, the renal tubules are shrunken, hemorrhaging and infiltrated with eosinophilic granular cells. In addition, focal myolysis develop in the muscles. The disease is detected by signs of the disease, electron microscopy, and isolation or identification of the virus. Next is the lymphocystis disease. This viral infection is also caused by iridovirus. It affects Lattice species and Signatus species. Infected fish have clusters of pear-like nodules up to 5 mm in diameter that develop on the skin, gills, or fins, resulting from an enlargement of tissue cells. The disease is rarely fatal in older fish. It can be transmitted by cohabitation exposure to contaminated water. Signs of the disease, histopathology, and electron microscopy is used to diagnose this viral infection. Another viral infection is the grouper iridovirus of Taiwan disease, or TGIV. Iridovirus is also the causative agent of this disease. It affects grouper or Epinephelus species. Deceased fish swim in circles and are anemic. Fish lose appetite, then become underweight and lethargic. The spleen of affected fish has abnormal hypertrophied cells containing numerous icosahedral virions. The disease affects farm groupers, 5 to 8 centimeters in total length at 25 to 28 degrees Celsius. Acute disease causes up to 60% mortality. The signs of the disease and electron microscopy are used to diagnose the disease. Lastly, the sleepy grouper disease, or SGD. This viral infection is again caused by iridovirus. It affects Epinephelus tauvina. Affected fish exhibit extreme lethargy and low appetite. Affected fish swim alone or hung at the water surface or remain at the bottom. Acute disease causes up to 50% mortality, mostly occurring during the night or in the early hours of the morning. Gradual mortalities follow after fish become sluggish over 3 to 5 days, after which affected fish lie at the net or tank bottom exhibiting weak fin movements. Some terminally ill fish display gill pallor, rapid opercular movements, and frantic dashing to the water surface to gulp air. Acute mass mortalities may occur 12 to 24 hours after handling or excessive feeding. Internal pathology consists of enlargement of the spleen or occasional enlargement of the anterior kidney and heart inflammation. The virus was detected in the spleen, heart, kidney of infected fish. Major viral infections of pennate shrimps. Shrimps can also be affected by viral infections. One of these viral infections is the white spot syndrome virus, or WSSV. This viral infection is caused by baculovirus. This disease is also called as white spot baculovirus, white spot virus, systemic ectodermal and mesodermal baculo-like virus, Chinese baculovirus, hypodermal and hematopoietic necrosis baculo-like virus, rod-shaped virus of Penaeus japonicus, Penaid acute viremia, Penaid rod-shaped dovavirus. It affects all stages of shrimps like Penaeus monodon, Penaeus chinensis, Penaeus indicus, Penaeus penicillatus, Penaeus japonicus, Metapenaeus ensis, and many more. It also affects other crustaceans such as Scylla serrata, Charybdis feriatus, Helis tridens, Calapaiophus, Portunus pelagicus, and etc. Typical signs of disease are the presence of distinct white cuticular spots, most apparent at the exoskeleton and epidermis of deceased shrimp about 2 days after onset. The white spot starts at the carapace and 5th and 6th abdominal segments that later affects the entire body shell. The moribund shrimp display red discoloration and have loose cuticle. Affected shrimps manifest surface swimming and gathering at pond dikes with broken antenna. Reduction in food consumption and empty gut develops, followed by a rapid onset of the disease and high mortalities of up to 100% in 3 to 10 days. This disease affects a wide host range of crustaceans and targets various tissues such as pleopods, gills, hemolymphs, stomach, abdominal muscle, gonads, midgut, heart, periopods, lymphoid organ, integument, nervous tissue, and the hepatopancreas, resulting in massive systemic pathology. Shrimps, 4 to 15 grams, are particularly susceptible, but the disease may occur from mysis to broodstock. Pre-molting shrimps are usually affected. Crabs, krill, and other shrimps are viral reservoirs. Clinical signs are diagnostic for this disease. However, recent reports indicate that some bacteria may induce similar signs, hence confirmation with other diagnostic tests should be done. Demonstration of the presence of hypertrophied nuclei in stained squashes, smears of epithelial and connective tissues of the gills or stomach of affected shrimp. Histological sections show widespread cellular degeneration and severe nuclear hypertrophy, chromatin margination, and eosinophilic intranuclear inclusions in the subcuticular epithelium of the shell, gill, stomach, connective tissues, hematopoietic tissues, lymphoid organs, antennal gland, and nervous tissues. Confirmatory diagnostic test for this viral infection is electron microscopy, PCR, DNA probe, Western blot, and infection bioassay. Next is the monodon baculovirus disease or MBV. The viral infection is caused by P. monodon type baculovirus. It affects giant tiger prawn, Penaeus monodon, and other penned shrimps like Penaeus margiwensis, Penaeus vanamae, Penaeus esculentus, Penaeus semisculcatus, Penaeus penicillatus, Penaeus plebeius, Penaeus kerathurus. Affected shrimps exhibit pale bluish-gray to dark blue-black coloration, sluggish and inactive swimming movements, loss of appetite, and retarded growth. An increased growth of benthic diatoms and filamentous bacteria may cause fouling of the exoskeleton or gills. Infected pond-reared shrimps at 45 days of culture, stocked at 4 to 100 per meter squared, manifested slow growth rates and pale yellow to reddish-brown hepatopancreas. The virus causes destruction of the hepatopancreas and lining of the digestive tract. Spherical eosinophilic occlusion bodies fill up enlarged nuclei of hepatopancreatic cells and are discharged into the lumen after cells have been destroyed. This may be followed by necrosis with secondary bacterial infection. It is associated with a high incidence of bacterial infections expressed as localized shell disease. To diagnose, demonstration of occlusion bodies in wet mounds of feces, midgut, or hepatopancreas stained with malachite green. Histological sections show presence of eosinophilic multiple occlusion bodies within the hypertrophied nuclei of the hepatopancreatic tissues with the following development. Other diagnostic tests are DNA probe and PCR. Next is the infectious hypodermal and hematopoietic virus, or IHHNV. Parvovirus is the causative agent of this disease. This viral infection affects post larvae, juveniles, and adults of Penaeus monodon, Penaeus stylirostris, Penaeus vanamae, Penaeus semisculcatus, Penaeus smithii, Penaeus setiferus, Penaeus asticus, Penaeus duorarum, Penaeus californiensis, and Penaeus japonicus. Shrimps show erratic swimming behavior, rising slowly to the water surface, hanging and rolling over until the ventral side is up. Eventually, the animal sinks to the bottom. Shrimps would eventually right themselves up, become weak, and lose their appetite for food. They repeat the process of rising to the surface and sinking until they die, usually within 4 to 12 hours. The shrimps manifest decreased preening and delayed molting. Acutely affected shrimps develop white opaque abdominal muscles, bluish to distinctly blue cuticular color, often with mottled buff to tan pigment patches in the cuticular hypodermis and very soft cuticles. They have poor resistance to stress. Mortality rates of above 90% were observed among penny juveniles in intensive culture systems. The virus infects cells of the ectodermal tissues like epidermis, hypodermal epithelium of the foregut and hindgut, nerve cord, and nerve ganglia, and the mesodermal tissues such as hematopoietic organs, antennal gland, connective and striated muscles, heart, gonad, mandibular organ, and hemocytes. It induces the development of eosinophilic inclusion bodies in the cytoplasm of affected cells during the early acute stage of the disease, followed by necrosis and inflammation of the target tissues. The presence of the virus can cause death of the cells of the cuticle, blood-forming tissues, and connective tissues of the shrimps that leads to the abnormal metabolism and eventually mortalities. Inclusion bodies are common early in acute infections, later decreasing in number, followed by necrosis and inflammation of target tissues. It has been linked to the runt deformity syndrome in L. vannamei. Secondary bacterial infection may occur. Some survivors of epizootics may carry the virus for life. Histological demonstration of eosinophilic intranuclear inclusion bodies in the hepatopancreas by hematoxylin and eosin staining. Electron microscopy, PCR, DNA probe, infection bioassay are other diagnostic tests. Another viral infection is the yellowhead virus or YHV. This viral infection is caused by rhabdovirus. It affects subadults and broodstocks of Penaeus monodon, Penaeus asticus, Penaeus dugurarum, Penaeus merguensis, Penaeus setiferus, Plaemon, styliferus, and Acetis species. Infected shrimps show light yellowish, swollen cephalothorax. The gills appear whitish, yellowish, or brown. Before the appearance of clinical signs of disease, the shrimps develop an abnormally high feed intake and rapid growth. Thereafter, there is marked reduction in food consumption prior to cessation of feeding and the onset of rapidly accelerating mortality. Moribund shrimps swim slowly near the surface of the edge of the pond. The occurrence of this disease may be associated with unstable phytoplankton bloom, bad pond bottom, high stocking density, or exposure to pesticides. Systemic infection is associated with virus assembled in the cytoplasm of ectodermal and mesodermal cells such as gills, lymphoid organs, hemocytes, and connective tissues. Massive necrosis is attributed to cytoplasmic replication of the virus. The virus can cause total crop loss within 3 to 5 days of onset of clinical signs with incubation period of 7 to 10 days. The virus in water remains infective up to 72 hours. Shrimp reservoirs include Plaemon, styliferus. For the diagnosis, signs of disease and phase contrast microscopy of fresh hemolymph stained with Wright or GEMSA stain. Histopathological analysis show the presence of basophilic, usually spherical, perinuclear cytoplasmic inclusions in the hemocytes, lymphoid organs, hematopoietic tissues, pilar and epithelial cells in the gills, spongy connective tissue cells in the subcutis, muscle, gut, antennal gland, gonads, nerve tracts, ganglia, and other cells of the ectodermal and mesodermal origin. Electron microscopy, Western blot, RT-PCR, and infection bioassay are confirmatory diagnostic tests. Lastly, the hepatopancreatic parvo-like virus or HPV. This viral infection is also caused by parvovirus. It affects both larvae, juveniles, and adults of Penaeus monodon, Penaeus merguensis, Penaeus vannamei, Penaeus esculentus, Penaeus semisulcatus, Penaeus penicillatus, Penaeus indicus, and Penaeus chinensis. Affected shrimps develop loss of appetite and retarded growth. Benthic diatoms, protozoans such as Zoothamnium species, and filamentous bacteria may cause fouling of the exoskeleton of infected shrimps. Occasionally, white opaque areas of the tail or abdominal muscles are observed. The virus causes hypertrophy of the hepatopancreatic nucleus with lateral displacement and compression of the nucleolus or chromatin margination with development of a prominent basophilic occlusion body. This leads to cell death and shrinkage of hepatopancreas. Damage of this organ can result in abnormal metabolism and eventually death. Signs of disease and histological demonstration of single prominent basophilic intranuclear occlusion body in the hypertrophied nucleus of the hepatopancreatic cell are diagnostic. Electron microscopy, DNA probe, PCR, infection bioassay are confirmatory tests for this viral infection. Prevention of viral infection. There are no treatments for viral infections of fish and shrimps. Hence, preventive measures should be adopted to keep the viral pathogens away. The basic consideration in preventing the occurrence of viral disease is avoidance, and use of virus-free fry for stocking in ponds is highly recommended. It should also be borne in mind that semi-intensive and intensive culture systems promote conditions conducive for disease development. As such, reduction of stress and the application of good husbandry or efficient technology may deter the occurrence of disease. Other prevention and control techniques are using specific precautions of egg washing with ozone disinfected seawater, using fine screens for inlet water and adherence to strict hygiene, stress test of shrimp post-larvae with 100 parts per million formalin for 30 minutes with aeration and stocking only tolerant post-larvae, the use of only dry commercial feeds and pasteurized fresh feed at 60 degrees Celsius for 15 minutes before use. Feeding with feeds containing 100 parts per million phosphated ascorbic acid for 92 days were reported effective for viral infections. For the management of WSSV, the effective use of immunostimulants mixed with feed such as peptidoglycan at 0.2 mg per kg body weight per day for 2 to 3 months, or fucoidan, an extract from cladocyphone ocamirans at 50 to 100 mg per kg shrimp per day for 15 days were reported to increase survival of WSSV-exposed shrimps. It is also important that surveillance of early signs of disease and stressful factors become essential components of farm or hatchery management in order to monitor the health status of fish stocks, to assess adequacy of rearing procedures, and to prevent introduction of pathogens. Early detection of a disease outbreak will reduce mortalities and prevent catastrophic spread of the virus. Lastly, since virus can remain viable outside the living host for at least 72 hours, water change should be contemplated only at least 5 days after effluents from infected ponds in the area have been discharged.